Good morning, everyone. We'll start today's Metro COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. We're joined today by Dr. Brett Campbell, a critical care anesthesiologist at Ascension St. Thomas Hospital West. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning. As of today, Nashville is continuing to see the same increase in coronavirus numbers that required our decision to respond with a modified Phase 2 last week. Across the U.S., COVID-19 cases continue to surge, surpassing 3 million total cases nationwide. Dozens of hospitals in Florida have run out of ICU beds. California has had to add new intensive care capacity. Arizona has nearly maxed out of ICU capacity, and Texas reported a single-day record high of 10,000 new cases on Tuesday, also stretching its healthcare capacity. Yesterday, Tennessee also set a single-day record with almost 2,500 new COVID-19 cases. And this morning, Metro Public Health is reporting Nashville's worst day of confirmed cases on record at 688, with 8 confirmed deaths related to the virus. Our 14-day case average is 273, and our transmission rate is at a median of 1.23. Both metrics are in the red. Our local hospitals currently have 22% of ICU beds and 20% of floor beds available, which meets or exceeds our target of 20% for each of these metrics. And Dr. Jahangir will discuss our COVID-19 data in more detail momentarily. On Tuesday, I outlined several primary sources of COVID-19 infection identified by our contact tracing investigations, indicating that more than 70% of new cases now come from non-essential activities. Yesterday, the Texas Medical Association's COVID-19 Task Force and Committee on Infectious Diseases ranked 37 common activities on a scale of 1 to 10 for risk of coronavirus exposure and infection. Now, low-risk activities include grocery shopping and exercising outdoors. But the following activities were designated as moderate, high to high risk by the Texas Medical Association's committee and have also been confirmed by our public health experts. At the top of the list is going to a bar, attending a religious service with more than 500 worshipers, going to a sports stadium, attending a large music concert, going to a movie theater, going to an amusement park, and eating at a buffet-style restaurant. While many health experts predicted that Japan would be hit hard by the pandemic, that country has successfully flattened the curve of the coronavirus. And in addition to widespread adoption of face coverings, residents across Japan closely followed the 3 C's to successfully avoid infection: closed spaces, crowded places, and close contact settings, especially in those settings that involve loud talking. As a reminder, Texas recently closed all bars statewide due to a recent spike in COVID-19 cases. And as of yesterday, all bars in Shelby County, Tennessee have closed to the public. Shelby County's transmission rate has risen to 1.24 over the past weekend, which is similar to Davidson County's median transmission rate of 1.23. Now, since Nashville's face covering ordinance was first announced, approximately 10 other counties across the state have adopted similar protocols, including our neighbors in Montgomery, Robertson, Williamson, and Sumner counties. 22 states have now mandated the use of masks and face coverings when out in public to slow the spread of the coronavirus, including Kentucky and Virginia, both of which have significantly lower transmission and positivity rates than Tennessee. A majority of our peer cities and many other U.S. cities with global tourism industries have issued mask ordinances to protect their residents and workers and to ensure the long-term success of their local tourism economies, including Austin, Atlanta, Chicago, Charlotte, Denver, and Orlando. As I have said before, a coordinated effort is the most effective effort. which is especially important as we confront our current public health crisis. Our experience with this disease continues to prove that public health is best when in a concerted effort at the local, state, and federal levels. Now, it is worth noting that a recent report by the University of Washington's IMHE estimates that if masks were required throughout the state of Tennessee, there would be an average of just 50 cases each day by November the 1st. The report concludes we could potentially reduce the expected loss of life in Tennessee by 50% by October the 1st by wearing masks. We need to listen to public health experts to help us protect Tennesseans and ensure the long-term success of our economy. Now, analysis by Metro Public Health has found that since June the 15th, when our most recent spike of cases began, nearly 3 out of every 10 Nashvillians with COVID-19 are between the ages of 25 and 34. All age groups under the age of 35 have risen since June the 15th, while rates of infection among all older age brackets have decreased. Nationally, people under age 40 now make up the majority of COVID-19 cases. Now, mortality rates among young adults are not as high as older adults, but young adults are certainly not immune to suffering from the disease, succumbing to it, or spreading it to others. Stopping the spread of the disease from the young to an older cohort, which in many cases can be fatal, has to be a priority of all our public health efforts. Now, the virus can be fatal to the young too, as reported by local news media Darius Stettles, a 30-year-old male and resident of Davidson County with no reported or known medical history, died of complications related to COVID-19 on the 4th of July. And we join Darius's family and friends in mourning his tragic and untimely death. Now, those who are fortunate enough to survive COVID-19 may face long-term breathing problems, neurological problems, and cognitive deficits that may result in a permanent loss of independence. Many people in Nashville have pre-existing conditions that will make treating COVID more difficult with worse outcomes. Asthma, diabetes, heart disease, common pre-existing conditions add to the peril of the disease. It is estimated that over 35% of all Tennesseans have high blood pressure. Now, this morning, I want to welcome Dr. Brett Campbell, a critical care anesthesiologist at St. Thomas Hospital West, who is with us this morning to discuss his experiences in the ICU and the importance of taking personal precautions to keep ourselves and each other healthy. Remember, your efforts, each one of our efforts, will determine our public health outcomes. Please wear face coverings in public places, maintain a safe social distance from others, and visit a Metro Community Assessment Center to receive a free COVID-19 test if you feel symptomatic or believe you may have been exposed to the virus. I'll now turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 13,425 confirmed cases. That's 1,088 new cases in just 2 days. There are currently 4,579 active cases in Nashville, and that's up 567 since Tuesday. 65% of all cases, or more than 8,700 residents, have now recovered from the virus. Since our update on Tuesday, 10 Nashvillians have died because of COVID-19, and 129 Nashvillians have now died as a result of confirmed COVID-19, making our mortality rate for our city at 1%. Our 14-day rolling average of new cases continues to increase. This morning, the average is 297. That's around 30 cases more per day since our update on Tuesday. The transmission rate in Davidson County, as the mayor noted, is 1.2. And we continue to monitor hospital capacity very closely. This morning, 22% of ICU beds are available and 20% of hospital beds are available. And 188 people are currently hospitalized in Nashville hospitals because of COVID-19. This is up 31 people since Tuesday. 7,021 residents were tested in the past 2 days, and 15.5% of them were positive. Overall, more than 116,000 Nashvillians have been tested for COVID-19, and 11.6% of those individuals have been positive. The doubling rate of the virus is at 23.6 days. This is still over our 14-day threshold. However, this number is heading in the wrong direction and is where we were 2 months ago. We have to go back to what we were doing a couple of months ago and redouble our efforts to fight this virus. This means first get tested if you have any concern about the virus. The community assessment centers are open today and every Monday through Friday from 9 a.m. to 3 p.m. They're located at Meharry Medical College, at Nissan Stadium, and at the old Kmart on Murfreesboro Road. You know, we've increased our capacity at Nissan Stadium with additional tents and personnel. And I actually visited there yesterday, and I saw National Guard working side by side with our partners from Meharry Medical College to give every Nashvillian who needs a test. This week alone, 6,200 people have been tested at our 3 community assessment centers in the first 3 days of this week. It is really important to stay home if you can. And if you have to go out, wear a mask. I cannot overemphasize this very simple thing you can do. As the mayor noted, the University of Washington's IHME report did show that wearing a mask would greatly drop the mortality of this virus in the community. But to be successful, 95% of our community needs to wear a mask. And masks are just one way to fight the virus. The other two, very easy. Wash your hands and keep your distance. Now, it's clear the numbers are going up and all of us are frustrated. And it's been a really long 4 months. However, COVID-19 is not going anywhere if we continue doing what we're doing. And with the data going in the wrong direction, we all need to recommit our focus and make sure we do everything we can to stay safe. The faster we can flatten the curve, the sooner we can go back to reopening society. I now would like to introduce Dr. Brett Campbell, an anesthesiologist and intensive care physician at St. Thomas Hospital. Thank you.
Thank you for the introduction. First off, I'd like to say that I really appreciate the opportunity to come here and speak today. I've been proud to be a part of what has been a significant collaboration of resources and knowledge that I've really come to expect when Nashville faces a crisis. First, I've got the bad news. The bad news is that the coronavirus is a very serious infection. And as an intensivist, I deal with typically the sickest cases that come through the hospital. Severe ICU courses of coronavirus can typically last weeks, sometimes months. All of these severe cases require intubation, which is where we put a breathing tube through your mouth into your trachea or windpipe, and then ventilation, which is where we put you on an artificial breathing machine to help support your lungs. Most of the cases that require intubation also require placement of additional invasive lines, tubes, catheters. These are things that we can give you nutrition through, that we can give you medications, fluids, and monitors. Many of the patients that are sick with coronavirus develop dysfunction of other organ systems. Kidneys is a very common one. Some patients require dialysis, which is another invasive catheter. That's to clean the blood. And then a lot of these patients develop disorders of the clotting system. That seems to be typical for coronavirus, uniquely pronounced, I'd say, in this disease. Some of these patients develop lung disease that's so severe that they progress to the point that they need prone ventilation, where we actually have patients on their stomach. We have special beds that help us do this, but oftentimes we have our nursing staff and providers turn the patients manually when we don't have availability of those beds. And then some patients are so severe that they require ECMO. And ECMO is essentially a very high intense therapy where we take the patient's blood outside of their body through catheters, oxygenate it, and then return it to the patient. And that's the primary way that they get oxygen. As you can imagine, those types of support mechanisms require a lot of staff, a lot of resources. Despite all these interventions, some of the patients don't survive. For those that do survive, the road to recovery is long and often can be very challenging. Significant weakness results from being on the ventilator from muscle loss. Those patients often require staying on the ventilator for prolonged periods of time. Some of them require tracheostomy, where we move the breathing tube from the mouth to the front of the neck. That helps us to wean them from the ventilator. Patients often develop delirium in the ICU, which can be extremely difficult, not just for them, but for their families. And that's particularly true because families aren't often allowed to be with the patients, and so it can be very hard to see them suffering through that. The patients can also have lasting damage to certain organ systems, kidneys, as well as, of course, the lungs. We see scarring in the lungs that can last and make the patients have difficulties with breathing for prolonged periods of time, even after they've recovered from the acute phase of their illness. And then there's a well-described psychological trauma of going through the experience of being a patient in the ICU. It's very similar to PTSD. So it may be easy to think of yourself as invulnerable to this experience, but I would ask you to consider that our highest ICU volumes for our hospital and the highest acuity, that means the sickest patients that we've seen, have come in the past few weeks. This runs in tandem to the increase in new cases that have been diagnosed in our region. It's not very surprising. What's more surprising is that while we have treated severely ill patients across the age spectrum, from the very young, we've had a few patients in their 20s who have been very critically ill, the majority of the patients that are severely ill are in their 50s and 60s. So you may not be in that age range, but I would bet that you know somebody who is, and you care about them. So on to the good news. First, we've treated severe viral illness before. A lot of the same foundational basic principles for the treatment in the ICU of viral illness apply to coronavirus, a lot of the support mechanisms. So we have a good foundational basis for treating viral illness. Secondly, the sheer volume of global cases has led to a flood of experience and scientific learning that has made us better at treating this virus in particular. Lastly, and perhaps most importantly, is that this disease is preventable. Those of us who deal with COVID patients on a daily basis share an enthusiastic respect for social distancing and personal protection while we're at the hospital. But it doesn't end there. We recognize our role in helping prevent the spread of illness and protecting the well-being of our community. We also recognize that we can't do it alone. Fortunately, this is Nashville. Nashville has faced crisis after crisis before and has united against it and has overcome. So I would urge everyone to take simple steps such as social distancing, avoiding large crowds, washing your hands frequently, and of course, wearing a mask when you're out in public to protect not only yourself, but those around you. We all have a role to play in stopping the spread of this disease. Please do your part. Thank you.
Thank you, Dr. Campbell. We'll now begin taking media questions, starting with Nancy Amons at WSMV. Nancy.
Hi, thank you. In light of today's numbers, is there any discussion of going back to phase 1? Can we flatten the curve with the virus spreading exponentially? Thanks.
Thank you, Nancy. And here to answer your question is Dr. Jahangir.
Thanks, Nancy. You know, I think all options are on the table, frankly. We just a week and a half ago, we placed in a mask order. Just a few days ago, we went to the modified phase 2. Let's see the impact of those. But I want to be very clear. Wearing a mask is extremely critical. Having a regional approach to this is extremely critical. So again, I want to reiterate what I said at our last press conference, is I really need leadership from our counties around Nashville, because we are not in isolation here. So while, let's see how the things we've put into place work, but we need people to actually work with us and make this happen. But if we want to save as many lives in this city as we can. So that's how I'll leave that. Thank you.
Blake Farmer at WPLN, you're on the air.
Yes. When you all talk about bars, have you all had any problems with bars refusing to close? I know there were a few early on, but have you all had to take any further measures to force some of these limited service restaurants to close?
Thanks, Blake. Hugh Atkins.
Thank you. Yes, last weekend we had a few bars that we had to make visits to because we found out that they were operating. And the ones that we went to, once we explained the order to them, voluntarily closed and ceased operations immediately and had the patrons leave. There was some legitimate misunderstanding when we moved to Order 9 that when we had Order 1, when we originally reduced capacity to 50% and closed bars, bars were allowed to modify their operations somewhat and operate as restaurants and be at 50% capacity. That was not the case with Order 9. We were asking them to completely close. So in each of the places we went to this past weekend and required them to close, again, they voluntarily complied, and their explanation was that they thought they were going back to the same practices as Order 1. Thank you.
Mr. Peter White at the Tennessee Tribune.
Hi, thanks for doing this. I have two questions for the mayor, and I'd also like Dr. Jahanger to answer the second one. President Trump said the other day that he was going to put the pressure on governors to reopen the schools in the fall. So my question to him is, that probably would come through Governor Lee's office, if the mayor has received any pressure to reopen the schools. And my second question is, in places like Germany, which the president referenced the other day, they are reopening the schools, but they're doing two things that we are not doing and cannot do. One is they're putting money into schools, and as you know, the HEROES Act is sitting on McConnell's desk. So we don't have the money to open up the schools safely. And secondly, Germany has reduced the infection rate. Ours is going in the other direction. So my second question is, if that does not change, will the mayor order the schools to stay closed? And I would like Dr. Jahanger to comment on his part of that. Is he going to recommend that they stay closed if we don't improve those metrics?
Thank you, Mr. White. Mayor Cooper.
Thank you, Peter and the Tribune. There's a press conference today at 1 o'clock that Director Battle is going to be having to, I think, go over in detail their phased plans for reopening. They'll have a lot of details. I encourage everyone to tune into that. There's nothing more important than getting our schools back. This is one of the most distressing things about the most recent outbreak and increase in cases is the challenge, the extra challenge that it puts on to schools. Now, if I can, but I've received no pressure one way or the other, but there are missing resources. It's clearly going to be more expensive to reopen the schools, which Nashville is trying to address with its moves in the digital divide. But federal money would be welcome, particularly on this great national priority, and as the national government focuses on getting schools reopened, make good their challenge to us and give us the resources to do it. You know, don't just say we want you to do it, give us the resources to help make that possible.
Thank you, Mr. White. As you know, I've co-chaired the Nashville plan for schools with Dr. Battle. Our committee kind of set oversight for guidance for all types of school systems, right? So private, public, parochial, and charter. And what I learned personally through that process is that each school has a different context in which they work with in regards to starting times, in regards to student populations and facilities, and operating requirements that make it a very different decision within each of these contexts. And so what I've learned through this process also is that each of the school system leaders with whom I work with are looking at all that context and have put the health of their students and their faculty of utmost importance, and they will look at with what's best in health as well as what makes sense within the context they work with. So I think each school system will have to evaluate that and make decisions based on the context in which they operate. So I'm very confident in the leaders with whom I've worked with that they will make the right decisions for the schools in which they oversee. Thank you.
Kara Hartnett at the Nashville Post.
Hi, thank you. I have two questions. Just piggybacking on that last one, Mayor Cooper, what are other aspects of the state or federal response that are impeding on your ability to respond to the virus here, short term or long term, and what sort of efforts are you pushing for those? And then, Dr. Jahanger, can you provide benchmarks for your future response? At what point will elective surgeries be suspended? At what point would stay-at-home suggestions turn into mandates again? And will restrictions go back and forth like that, like we've seen recently, until there's a vaccine? Or are you starting to see a sort of sweet spot in your response efforts that may become just a more consistent rule?
Thank you, Kara. Mayor Cooper.
Well, thank you, Kara, for that question. It is something I worry about every day. The challenge is what are the resources going to? Every city, every state is kind of on its own in improvising worthy solutions to meet the needs of the community, but so much is left unaddressed. Who pays for tests? Do we pay for contact tracing? Who's paying for PPE in schools? Who's helping us cover the digital divide? The broken social safety net in every community. The unclarity about is there going to be additional federal help for what? We have too many needs. We have to address schools, public health, getting people back to work, restarting our economy, their own challenging economic needs in this time of unemployment, and then there is no national clarity. There are buckets of money, but there's no national clarity on what is actually being paid for by whom. The previous question flagged this constant challenge of, in effect, be giving mandates to reopen schools, but not necessarily the resources to do that. The national quest for testing, who's paying for testing? Who's paying for contact tracing? Are we allowing every community to be only as good as its local efforts and its local funding? So anyway, you hear me express my frustration, but I don't think I am at all different. I'm frequently on conference calls with other mayors. Every single mayor in the country has the same set of questions. And I suppose they do at states as well.
Thank you for your question. So in regards to hospitals, I think it is, this is an area I focus on a lot over the past several weeks. Almost every single day, I speak to leaders in the state. I speak with the CEOs of every hospital system. I personally look at the state's HERTS dashboard probably more than I even should every day, because it is something that does give me a lot of concern. So to your question of what is that trigger to for example, open the alternative care site in Nashville General? Well, the state makes that decision, but we're working very closely with them. The numbers we provide to you when it comes to hospital capacity every day, that is hospital capacity without each individual hospital implementing their own surge capacity. So to my knowledge right now, from my conversations yesterday, no hospital has per se implemented their own surge capacity to augment the hospital capacity. But then on top of that, as I mentioned, there's a benchmark number that I don't know off the top of my head. I apologize, that the state follows every day to look at what total capacity is in Nashville, and when you hit this line, then they'll staff up for the alternative care site. We're not there yet. I don't believe Memphis is there yet because they equally have a same number that the state follows. Regarding the other metrics as to when one rolls back, this thing is changing so rapidly. I can't, in good faith, give you a number and just tell you that it's that if we hit this number, we're gonna do it. I do think mortality rate, hospitalizations, these are really critical right now as we move forward. And I wish I'd give you more, but I really do want to, as I mentioned in an earlier question, I really do want to see what the impacts of the mask mandate we've given our city is, as well as rolling back to a modified phase 2. So let's see how we do over the next few days or maybe week, but that is something we're going to watch very carefully. Thank you.
Dennis Ferrier, Fox 17.
All right, thank you so much. With the, this is for Mayor Cooper, with the kind of disappointing turn of the COVID and the cases spiking and, being in phase 2, and we're looking, businesses at 50% for March, April, May, June, July, maybe even August, September. We don't know where it ends. They're without question going to have their worst year ever, and restaurants at 50%, as we all know, do not make money at all. They lose money, but it's better than being closed. Does it not seem almost cruel at this point to ask for a 34% property tax increase from businesses that, without question, if they survive, are going to have their worst year ever? Thank you.
Thank you, Dennis. Mayor Cooper.
Thank you for the question, Dennis. As I've said many times before, it's terrible. It's awful. It's necessary. The loss of revenue, and every single other locality is going to deal with the same problem. The loss of revenue, the sales tax revenue, of which local government is often built on, requires the shift in revenue, frankly. Otherwise, you are going to have massive furloughing of the whole city government, which I do believe we need to get back to work. And often left out of this discussion is that the new tax rate here in Nashville is really below what it was 3 years ago. It's below what it was 3 years ago. Let's just say that a third time. It's below what it was 3 years ago. This is not some spike that is afflicting our local businesses. This is, unfortunately, having to pull back what was the lowest tax rate in the lowest tax state and the lowest tax city in America. So it's terrible, and it couldn't be worse timing for us to do it. But any other course which would jeopardize our ability to be in business as a city. One of the things that happened on July the 1st is we are open for business as a city. Otherwise, we had run out of cash. We would not be able to pay our employees. We would not be able to pay public health or police or teachers or be in any position to be back to work. So I get it that you're able to say that this is the worst possible time. Of course it is, but the history of Nashville budget practices really had put us already in a hole, and then the COVID put us into an additional hole that we had to walk back, frankly, an abnormally low tax rate to what is still below our historic rate and below what it was even 3 years ago. So it's something that I and the council felt as stewards of the community. It was an unfortunate but necessary thing to do, but that is leadership. And that's going to be leadership on wearing masks and walking us through the phases to be able to get us back to work. And for every business that's having the worst year that they've had in years, that is your motivation for asking people to do the right thing in public health. It is in your interest to get us back to work, right? Every one of us needs to look at each other and say, have we done what we need to do on social distancing today? Have we made sure that we are all wearing a mask? The sooner that we adopt a better health social protocol, the sooner we can get back to work. And the degree that we allow ourselves to slip backwards and be inattentive to this virus, the virus will not allow it. We cannot pretend when it's over. It is over when it's over. And we're going to have to walk through that carefully and rely on each other. This is the challenge to America. For success here, we have to work together. And sadly, in America, that's become hard to do. But we can do it, and we will.
Ian Jung at the Tennessean.
Good morning. There are 312 cases recently reported in the past few days that came from tests in June. Does this mean those individuals weren't contact traced and could have unknowingly spread the virus if they didn't self-quarantine? Is there an idea how that delay could have had an impact on the cases we're seeing today? And in general, is Nashville's testing and contact tracing capacity? And my last question is, we've heard about watching the impact of the mandate and repeatedly that masks are critical. On Tuesday's briefing, we were told that police are still focusing on educating the public and that, quote, they will reach a point when they're ready to start issuing citations. My question is, when is that time? And is there still concern that the mandate can't be enforced here? Thank you.
Thank you. Dr. Jungir.
So to answer your first question, it's a hard question to answer because I don't know with certainty where all those tests came from, which lab. It could be, and I don't know this with certainty, but what you said, yes, it could be that part of those people got delayed results and they weren't aware they're positive. Our hope is if somebody is getting a test because they're worried about getting the test, they would self-isolate until they get the results. So I don't know which labs all those came from. Some of those individual labs actually have a online portal that people can get the results much quicker than it takes for the result to go from the lab to the state, then to us. So some of those delays, maybe you're mitigating by having a direct portal. So I don't know the exact answer to that question. I'll tell you that our community assessment centers, we did change our lab that we used a week or two ago, and we've now seen much quicker turnaround times at our city sites that we have ability to control. So the turnaround times for those, I'm happy, have gone down tremendously. But to answer your first part of the question, it just depends on which labs those came from. So thank you, and I'll let Mr. Atkins speak to your second question.
Yeah, on the mask mandate, first of all, I'd like to thank Dr. Campbell for his presentation today and the graphic description of what these coronavirus patients face when they're in ICU. And it frankly boggles my mind that after hearing something like that, that every thinking and compassionate citizen wouldn't pick up a mask before they went outside. But that being said, we have been working with the police department, and as the questioner said, they have been warning and giving out information about the mask mandate. We have been in discussion with Metro Nashville Police Department in the last couple of days. The last little thing they're ironing out is the legal process for how those citations will be handled once they're issued. Once that's ironed out, the citations will start to be issued to individuals that are found not wearing them. Thank you.
Brett Kelman at the Tennessean. Brett?
Hi, good morning, everyone. I want to revisit the question about the 312 delayed reports mentioned by Ihan a second ago. Okay. So I understand Dr. Jahangir's point that some of those people might have not been told they were infected, and some of them might have found out through a portal that is independent from the city. The question I specifically want to ask is if the city did not know about those infections and therefore could not contact trace those 312 people during the time that they were symptomatic and contagious. Because if that is the case, the damage that could be done by 312 people is obviously significant. So I'm specifically asking if the city knew about these people in a time that it could effectively contact trace them.
Got it. Thank you. Dr. Caldwell.
That's a really important point, and I think Dr. Jahangir said it best earlier, that if somebody is going to get tested, they should already be suspecting that they may be infected and need to do everything that they can to try to protect themselves. Contact tracing does happen at the time that we are informed of a positive lab result, but we do get informed in other ways. So while some of these tests may have been delayed and some of the contact tracing outreach may have been delayed, I think our overall message is to everybody that you must assume that you are carrying COVID. You must always assume that and wear your face covering. You must always socially distance, because whether or not we can do the active contact tracing in a timely fashion, every single one of us should assume that we can give this COVID. Dr. Jahangir.
And Brett, frankly, that's one of the reasons we've changed our community assessment center labs. It's not acceptable for us to have this delay, period. And so I think the concern you bring up is a very valid one, and there's probably some truth to what you said, but that is one of the reasons in fact, maybe one of the main reasons we've changed our lab to the lab we're using now, which has much quicker turnaround time. So thank you.
Our last question today is from Nayeli Alamia at 96.7 FM.
Hi, good morning. Dr. Alex Jahangir, you mentioned that we have to wait and see how the modified phase 2 works out before making any changes. Mayor Cooper mentioned more than 70% come from non-essential activities. Could we go back to phase 1 if the cases keep increasing within the next weeks? And how long in advance will you let the public know before those changes are officially made, now that business owners may need to, for example, restaurants, may need to know ahead of time? When the modified phase 2 happened, it was a 1-day notice. And Mayor Cooper, with the tax increase, several businesses have decided to close because of COVID and because of property tax increase. Will there be any help for those that have not been able to recover economically? For example, will there be like an extended time for them to pay those taxes? Thank you.
Thank you. Oh, I'm sorry. Do you mind repeating your second question about, you mentioned something about an extension, Nayela?
Yes. Will there be any help for those businesses that have not been able to recover economically? So will there be like possibly an extended time to make those payments?
You're talking about for property taxes?
Yes.
Okay. Thank you. Mayor Cooper will address that question first.
Thank you. And let's use your question as a platform. There are lots of programs that I encourage businesses. The first thing is to get businesses restarted. That's going to require social distancing and people wearing masks, people complying. That's what's going to get us on to back to our roadmap for recovery. So if we're talking about helping businesses, that's the first step. The second step is there are state and federal resources that they can use to help supplement their need. They're part of the social safety net too. We need vibrant businesses, particularly small businesses. By last count, I think there was $100 billion of loans from the Small Business Administration that had not even been applied for. I encourage businesses to apply and to reapply at this point and contact my office if we can facilitate those applications. Finally, the property taxes, of which will be a tiny fraction, the increase compared to what they normally pay, that is due in February. So I am hopeful that we're going to get our ship righted and get behind this disease by February and we can be back to normal. Now, it's astounding how persistent the virus is, and we had all hoped to be in better shape than we are, but let us be realists and understand the difficulty of the disease and then get on. First step is social distancing and compliance. It is when we, in a restaurant, if somebody is smoking, for a long time people used to smoke in restaurants, right? It was the other customers that put an end to that. It was the other customers that insisted on their right to a smoke-free environment. When we get to that same tipping point in Nashville where we have the expectation of wearing a mask, then I think we can get to this much better environment, which is flagged by the University of Washington report of, in fact, how masks alone do drive down the incidence of the disease, but it's going to require community enforcement, community involvement, community requests before that we're going to get on to the next phase. That is the first step to recovery. And that's what we need to get on with right now in the weeks ahead.
And to your questions around phase one, or going back, I want to highlight a few things. The difference between now and March is we've built a public health infrastructure now with a lot of public health investigators, contact tracers. We have about 125 now. We've hired about 20 more. Dr. Caldwell has directed essentially all hands on deck because I think anyone could say there's just, when you have 688 new cases in a day, 200 people is probably not enough to call those people, right? So I think I say that initially to then say this. We still do have about 125 to 130 people who are making calls. What those people are learning informs our decisions on how to move forward. So we went to a modified phase 2 based on data that we had obtained that showed that these individuals who are getting infected now were younger, were in the urban core, and were going to, different bars and parties. I mean, if you remember a week ago, I was telling you there was 10 clusters, and that was quickly identified by our public health investigators. So when we're talking about, are we going to roll back to a phase 1? I think we need to really think about the question of, will we pull the trigger to stop things that have been shown to cause further infection? And the short answer there is yes. We will have knowledge of what further infections are being caused by our public health investigator and contact tracing team. So I hate to just make a blanket, we'll go to phase 1 and phase 1 means blank. Rather, we will do everything needed to preserve the health of our citizens and residents in our city. And that's kind of the gist of it. But yeah, we'll do whatever needs to happen. Thank you.
And I'd like to add on to the mayor's comments. The PPP application program has reopened as of July 6th. The Nashville Financial Empowerment Center is offering free virtual financial counseling for small business owners, and you can visit covid19.nashville.gov to sign up for a virtual appointment at the Need Assistance link. That is all the questions for today. I'd like to thank Dr. Brett Campbell for joining us this morning. The next scheduled Metro COVID-19 press briefing will air on Tuesday, June 14th at 9:30 a.m. Thank you for joining us. That concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.